Welcome to Southern Steep, the public health and social justice podcast brought to you by NASDAD. Much like brewing stronger tea, this platform aims to brew stronger community by centering the voices of community leaders and their innovative work in the Southern United States. Today, I am your host, Bianca Ward, and I am joined by the amazing Nicole Elenoff. Hey, Nicole.
Hey, Bianca.
We're back reunited, and it feels so good.
So good. I was waiting for this opportunity for a long time since our last episode together.
I would have to run the analytics, but I am going to believe that our episodes are the best. And why should today be any different? So I feel like every episode we get better and better guests, cooler and cooler people, more amazing professional superheroes. And our guest today, Erin Snowden, is no different. So even before we get into the things, well, first, let me say hi, Erin.
Hi, Bianca.
Okay, wait, now hold. So Erin is amazing. And I have had the privilege of knowing Erin now. Are we a decade in? We're over a decade in.
Over a decade. It's been a while.
It's been a journey. Growth. So before we get into all of her amazing things, I am going to read her fancy bio. One, because yes, and I said fancy, because the amount of work, blood, sweat, and tears and knowledge she has poured into the community is phenomenal. So I think the folks need to know all of the things, and then we'll get to dive into who she is behind these fancy letters and words. So Erin Snowden is a native of the District of Columbia metropolitan region with a 15-year career in health education and public health program development and implementation. Following the completion of her bachelor's degree in health science, health education at Towson University, she taught at Prince George's County School System and was named the chairperson of her school's Department of Health Education after only 1 year of service. She later went on to receive her Master's of Public Health from the George Washington University, concentrating in prevention and community health with a focus on maternal and child health issues. Mrs. Snowden, there you go with the name, Mrs. Snowden. I like it. Had an opportunity to serve the Howard University community as the director of the Office of Health Education, where she oversaw the development, coordination, implementation, and evaluation of the Institute's health outreach, events, screenings, and wellness initiatives. Inspired by her love for her community, passion for maternal and reproductive health issues, and her personal experience, Mrs. Snowden made the decision to join Mamatoto Village, where she has had the opportunity to complete the innovative perinatal health worker training and currently serves as the Director of Data and Social Impact. She is completing her Doctorate of Human Services with a concentration in program evaluation and data analytics. Her professional experience and personal passion led her to create Hued Data Strategies, where she provides consulting services to Black-led grassroots organizations in an effort to create data stories that accurately depict the complex experiences of Black communities and acknowledging the importance of qualitative data sources that value Black ways of acquiring and transmitting knowledge. Ladies and gentlemen, rounds of applause, snaps where we are snapping for Mrs. Erin Snowden.
Thank you.
Your bio is a word.
I'm going to read that when I don't feel so great about myself. Like, that was awesome. Thank you.
You have always been a force as long as I've known you. The passion, the drive, and we're gonna again get into all of those things. But we have come a long way from HIV and STD testing there on Howard's campus.
Listen, we have come a long way from playing in urine all day. Collecting samples. I am proud of us, friend. Yes.
The story. If that little office could talk.
Yeah.
But HIPAA. confidentiality and things. So we won't even dive into that. But we have come a long way. But you have always been of service and community. Before we get started, because like I said, we're going to dive into the various aspects of your work and your role and your passions. But um, how did you get here? Tell us your why. Mm-hmm.
Wow. Wow. Yeah. How did I get here? I was one of those kids that went to college. I was always good at school, but I was never the star in the classroom, right? So I was decent. I did good. I got A's, but I was really working to get my grades. I was never the outgoing person, but I'm such a service person. I have a servant's heart, and I love biology and medicine, and I love people. So I went to school and said, I'm going to be a doctor, because nobody knows about public health. Like, going into school, that's not a thing, especially way back in the 90s. And so I wanted to be a doctor, and I sucked. All I needed was one semester of organic chemistry, and I was good on that. And then I discovered this magical world of public health. I discovered that I was actually a natural born instructor and teacher. And so my heart led me to the classroom. I've always worked with adolescents, and, by way of just the population I was serving, lots of sex, lots of drugs. Like, that's what I talked about all day long.
Yes.
Which developed my love of repro, and then just my own motherhood journey, of course, leads you, and then, or even before motherhood, questioning your own reproduction and sexuality and those kind of things led me into this world of maternal and child health. And so it's been a very natural progression from one thing to the next. I can say that what led me from more systems things to the community was that when I worked in those big, who doesn't want the corner office at Howard University when you're
Right.
20 something years old? Like, it was great, but I wasn't feeling fulfilled. I didn't feel like we were really making a huge impact beyond the walls of the campus in my particular role. And I just wanted, my friend said, I'm doing this thing, like, come and see what I'm doing and help me. And so I quit my job and I went. It was totally crazy. I don't recommend anybody quit their great job, unless the Lord really tells you to.
Someone leap and the net will appear.
It did. And I am thankful because it didn't have to.
We call that divine intervention.
Mm-hmm.
Absolutely. I have no other explanation for it besides that it all worked out.
So you got a call from your friend, and your friend said, what? I'm taking the perinatal health worker training.
Actually, the friend is the executive director of Mamatoto Village. And so she and I met when I was completing my my MPH at GW. She was working at DCPCA. I was interning there, working on the program that she was directing, and we just got along great. And we stayed connected ever since then. Just much like Bianca, I've met so many phenomenal Black women just doing the work in DC, and we are all very connected and tight knit. And so she had this idea to, again, her own journey in motherhood, giving birth to her children. She decided to basically start what started as a doula agency, right? So she wanted to provide, she got a very, very, very small grant, couple $1,000s. And her and Cassie, who co-founded the organization with her, said, we're going to use this money, train a few folks, and provide some free doula services to teens in DC. Great. They did that. But then after the grant period was over, it was just a hard stop. And they said, no, we can actually do this. And so they created a curriculum, and they started doing cohorts. I was in the second cohort of trainees. And then from there, so Aza is a trained midwife. She was training as a midwife when she was creating Mamatoto, and Cassie is in lactation. but they didn't have anybody in public health to kind of give this theory grounding to what they were doing and put all of the industry jargon and, theories of change and all of those kind of things to really solidify what they were doing in this world of public health that they were going to have to navigate to make it competitive with other groups that were out there. And that's where I came in. So the rest is history.
And the stars aligned.
Exactly. We call ourselves unicorns. So there's all of these people who work at Mamatoto that have various degrees and backgrounds that just magically come together to make what is Mamatoto Village. And so there's all these Black unicorns there that decided to quit their good job and come and serve and be broke for a couple years.
Well, y'all are truly magical and doing magical work. I first heard of Mamatoto Village when Bianca did the Southern Charm segment on the very first episode of Southern Steep. And then I learned more about y'all through the diaper drive that Bianca had. And I donated some diapers, and they're expensive. I'm not a mom, and I had no idea how much. But for our listeners, I wanted to share the mission and the vision of Mamatoto Village because you all are really doing some incredible work, and it's so cool to hear the history. So Mamatoto Village is devoted to serving Black women through the creation of career pathways in maternal health and providing accessible perinatal support services designed to equip women with the necessary tools to make the most informed decisions in their maternity care, parenting, and lives, with the vision of healthy mamas, healthy families, and healthy communities. Erin, you mentioned that you graduated from the second perinatal health worker class. How many health worker perinatals, how many doulas, perinatal health workers? What's the preferred term, perinatal health workers or doulas?
That is a great question, and I'm so glad you asked that question. So we do not use the term doula to refer to any of the women who work at our organization, and that is not to shade doulas or to say anything against doulas. I know some phenomenal doulas that are out here doing it, like doing a good work. The reason why we don't use that term is that there is a specific training that we put our staff through that enables them to better meet the needs of these high need communities so all of the communities that you see in like articles and that kind of thing, historically, where we are in the district, you will hear all about Ward 7 and 8. And so, a typical doula training is a weekend. It's 2 days, 2 to 3 days. And there is not a sufficient amount of information that's transmitted in that time that would give somebody, the knowledge needed to adequately serve and create impact in our communities. And so those women that are in dire straits, they don't need, and I don't even want to say that, Black women in general, because we also know that studies say that whether you have a gazillion degrees or whether you have a middle school education, you are just as at risk when you enter that labor room as a Black woman. And so we don't need back rubs. Like, we don't need hip squeezes. Like, that's nice. That's like the cherry on top, like, great. But we also need people that are very well versed in the social complexities that are making it so that we are not safe in our healthcare system. And so that is why we don't use the term perinatal health. Perinatal community health worker is much more encompassing. It respects the amount of knowledge that they're bringing. So they go through like a 6-month training. And so, and now there's modules to it. So it's like 3 months is your base, and then you can add on to whatever, based on whatever specialties you want to go in, such as lactation or those type of things. But yeah, it just doesn't do it justice. I could go on and on about the studies and the research, but I'll spare you.
And education today. Well, you mentioned that you found yourself feeling like an instructor role and an educator and really bringing it all together. And I appreciate, our Wednesday night I appreciate that. I had no idea.
Thank you. I'm glad.
So tell us a little bit about, so you mentioned the history kind of where Mama Toto began. Where are you all now in terms of going for the, couple $1,000s? What type of services are provided, the impact, the highlights?
Yeah, so we have grown exponentially over the last 6 years. I mean, the amount of growth in such a short period of time is sometimes mind-boggling. Like we have to wrap our like, wait a minute, what's what's happening? So from their initial iteration of Mamatoto Village, we approached some local managed care organizations. I'll use the term MCO because it's just easier, but those are the folks that manage all of the Medicaid recipients, contracts, so AmeriHealth and all these different organizations. So we approached them and said, hey, we have this organization. Here's what we do. We provide perinatal support in the way of education and labor support and postpartum care and lactation. We want to test this out with some of your clients and see how it goes. And they, of course, gave us a list of clients and they gave us their hardest clients. So the clients that they were tracking down for like months, like they cannot find these people for anything. And we were able to find them and we were able to build rapport with them and we were able to go into their homes and become sister friends with them. And they were like, how the hell did y'all do that? And
Unicorns.
unicorns, that's number one.
Professional superheroes. Carry on.
Yes. And that's it's unicorns and it's this. So part of our theory of change is like this proximity, right? I can't expect to go into a community that is not mine and be truly effective. You don't know me. Like you don't know me, you don't know my mama, like it just doesn't feel right. It doesn't make sense. It is not organic, our conversation. But when I go in, I make sense, right? So I make sense to the grandma that's sitting in the corner. I make sense to the husband or the boyfriend who might be there. I make sense to their sister or their girlfriends who are coming in and out. And so the level of comfort and reception is just through the roof. And then there's a trust that's built over time. And now we've got women back into care. We're attending their doctor's appointments with them. It just flows. And so that's when we say, like, we have to trust that communities have the answers to their own problems. You can't come in from the outside and expect to fix a community's issues. And so if we start listening to the community will always come through with the answer. So we've grown, we serve upwards. So, I could say like when we started maybe 50 clients a year, we serve over 300, close to 350. I think last year we topped out. We'll probably go more than that this year. And even so all of our clients are, besides our paid clients, so we do have women from the community who come and pay for services, and that money, of course, gets filtered right back into the programs that serve our Medicaid eligible clients. So all of our clients are Medicaid eligible. They have a host of various social determinants that put them at greater risk for negative outcomes. And despite all of that, they are out here doing it. Like these babies are healthy. They're born full term. I think our average week gestational age for birth is like 38. They are almost 70% of them were born vaginally. Most of them avoided the NICU. At 3 months postpartum, they're still breastfeeding. I mean, they are kicking ass. And and that is all because this program is culturally reflective of who they are. And it just makes sense. So we are trying to get Mamatoto in all Black communities, just this model of care, not to say that there's going to be us everywhere, but that we will be able to give other organizations this model. And we also want it to be able to be culturally layered with other cultural relevance so that it can be put in other communities that might be marginalized as well.
Amazing. So at this point, how many trained perinatal community birth workers do you all have? How many have gone through the program?
There's been hundreds of women that go through Mamatoto Village. And just because of the nature of our program, it used to be that who we train is who we hire. And that's that we have outgrown that model now because we're training so many women, which is also the point, right? So we want not only to be able to, this is a two-part thing. So we want also to have the great outcomes for the moms that we're serving, but we also want to be able to pour our knowledge into the women that we're training, and to have them be able to go out and be competitive in this world of maternal and child health, so that they can go get a job as a case manager, or a family support worker at one of our other local CBOs, community-based organizations, or the such. Some have gone on to medical school. We have folks at Yale's midwifery school. Like, I mean, it is crazy the places that the Mamatoto trainees go. And, you know, you can tell the difference in someone who is very well trained in the cultural aspects and the historical aspects of what we're seeing right now in Black maternal health, which I will say has not changed since the 1950s, y'all. Like, we talk about this stuff, these rates, like they're all new, like, oh my gosh, what's happening? These Black women, they're dying. No, we've always been dying. Y'all just decided to care. I'm gonna get off that soapbox too, but
we're doing it together. Do a shimmy together, because it's true.
It really has not changed since the 1950s. It just boggles my mind. But we want people with this knowledge to go in all the nooks and crannies of policy, of, you know, community work, of I mean, everywhere. We want to have somebody who has been trained at Mamatoto.
You're developing a unicorn army of advocates.
Listen, you're not ready. They're not ready for the unicorn Black power doula. It's about to happen. It's a takeover.
Well, and the advocacy piece, you mentioned that these numbers have not changed since the 1950s. What, you know, I know that Serena Williams and Beyonce, like, there was recently a cover story about these issues. And so what else do you think is getting the conversation going?
You know, I think that those familiar names sharing their stories is one thing that's helping. You know, before, even a decade ago when I had my first kid, I think that topics like this were a lot more hush hush. We didn't talk about motherhood, period. You didn't know that you were going to be wearing a diaper like you and your baby was going to have a diaper on. Like, we can't even
talk about that diaper, Erin. You put me on. Talk about
one.
Okay,
go ahead. I put you on. I said, Bianca, don't go to that hospital without this Depends, girl. Don't do it. And she did, and she was happy. So, you know, I think that is great. And I also think the power of social media, being able to really quickly get, when tragedy strikes, unfortunately, you know, people were able to turn a blind eye before, and you can't now because your timeline is about to blow up. And then I also think we have to be careful, though. We have to be careful not to allow respectability politics to trickle its nasty little fingers in throughout this, because it's easy to pay attention to Beyonce. It's easy to pay attention to Serena. It's easy to pay attention to me, you know, on a community level with all the degrees. And then let's get real basic. When you light skin with long hair, you know, it's like I fit the mold, but you can still say that you listen to a Black person. I've been at many a table where I was the diversity and I was the voice for Black women, but because I can speak in an academic way, and you respect my degrees, you respect my schooling, you respect my experience, but I want you to respect my sister that's coming from, you know, Berry Farms or wherever. You know, I want you to respect her as much as you respect me. And until we get there, we ain't talking about nothing. Like, I want to work myself out of a job, because really what's happening when I'm going into a labor room with a Black mother, especially the Black mothers that we serve in DC, I'm being a buffer between her and her physician. And yes, I'm providing comfort to her. I'm hands-on. I'm doing all of the things that a traditional doula does. However, I'm also able to translate between these two individuals, being the providers and the clients. And I'm also there to say, no, you need to talk to her, and here is what she's saying to you. And until I don't have to do that, then we still have a problem.
How powerful is that, just to have that advocacy in the delivery room? I wish, even, not today because it's not about me, but there are many times, just in my own birth story, that things I wish I would have done differently, or would have known, or advocated for, or learned after the fact. So how powerful is it to have somebody there to translate, to help you navigate, um, to help guide you through a process and a system that is not made for us in the first place? And so it is really powerful. I think that's the word that I have, to have that support, and just thinking about how many women don't have it. So, the unicorn army that you all are building are literally saving lives of Black women and their children. You can't put a price on that.
You can't. You can't put a price on it. It is invaluable. And it is so important, because what happens is when we educate so much on the front end. So when they are pregnant, we educate not just about we want them to know everything that could possibly happen as they're birthing, and all of their choices. And our thing is not to make a choice for you. Sis, you can walk in there and get every medication from the Ruta to the Tuta. Do you. But I want you to do so fully informed and on your own accord, not because you're being pressured or swayed or uninformed, just blatantly just omitting information from a provider, a nurse, or whoever. And it happens. We have had, again, HIPAA, but I have stories, you all, that you would not even be able to comprehend about some of the things that go on regularly about somebody's care. Like, oh, you don't want to if you don't want a C-section, like you need to go find a new provider because you're having a C-section. Like not even getting a choice. And so it is so important. And then even when so for myself, going into having my first child, I knew, or even second child, I knew all of the things, right? I had all of the book knowledge, but when you're pregnant and all that stuff goes out the window, and you're emotional. And then it's like, I just want to protect me. I want to protect my child. And so we are taught and conditioned to respect the knowledge of a person in a white coat more than we respect even our own knowing. Right? You just know. I just know because I know. But I respect you more than I respect myself. And so I'm going to trust you in this moment. And so it's important to have somebody there that can level that playing field and protect that sacred space. And, you talk about value. What's also very unfortunate in all of this is that now, since all of this conversation is coming up about Black women and the tragedies that are happening in hospitals across the nation, it's like, okay, community doulas, that's the answer. And then these insurance companies are saying, okay, we want to hire some community doulas, and we're going to pay you $300 per client to give them full care. So that's prenatals, that's attending the birth, that's postpartum care, that's lactation coaching. $300. Can you feed your family on $300?
I think it goes back to, and I've been hearing and saying a lot, people put money into what they value. And so that is why the underlining is, if you were only going to give $300, that is the amount. That's how much you value.
Absolutely. And that's how much they value someone that they perceive doesn't have I'm gonna just say this, like the colonized level of education and knowledge that
Mhm.
you want them to have, because there are women who have been attending births throughout our communities for eons and ain't get nary a degree and are phenomenal at what they do. There are women that are doing it right now, young women that are being trained by the elders, that are being trained at organizations, because we're not the only, Mamatoto isn't the only one, that are being trained by organizations like Mamatoto who are phenomenal at what they do. However, you think it appropriate to pay them $300 for all of their blood, sweat, and tears and knowledge, and then pat yourself on the back and say that you found the solution. I call BS.
Same.
Same. Just that model too is not sustainable because the number of clients that you need to serve to be able to make ends meet, and then you're having to like really cut time with the mamas that you're with, and then not everyone's getting what they need, and then the advocacy component, and it's just a setup for failure.
It absolutely is. And it is, it's predatory, and it is extending, just the financial depression, the economic depression in the communities to begin with, because you want, just like in our model, you want the doulas to come from the community because you know they have the end. So you're willing, these organizations are willing to exploit those women in order to gain the outcomes that they know they need. And they know that these women are saving them billions of dollars, literally. And you can't come up off more than 300. I mean, make it make sense. It doesn't. And so that's another thing that we're really passionate about at Mamatoto, is making sure that we have equitable pay, that we pay the women that work for us equitable fashion, that there is work-life balance, that, you're liable to see kids running around Mamatoto when you come in. It is what it is. But you can't, we in order to create healthy communities, you have to think about all of these things, and those models that are out there. I just, because people get so excited about, oh great, they're hiring community doulas, and I'm over in the corner rolling my eyes. So I just want everybody in the room to be very aware about what that means and what that looks like, so that we can all get on the same page about advocating for the right thing.
And a lot of that advocacy segue involves having the data, having the research, having the information. So tell us a little bit about hued data strategies in your doctoral
And my
stuff.
doctoral,
You're so fun.
yes, I'm in the writing phase of my doctoral journey. Thank goodness, y'all. Don't ever, like, school is for young folks. I'm telling you, I'm knocking on 40 and school is just not for me anymore. However, it is it's going well. So Hue Data Strategies is, data has always been a part of my job. From when I was in the classroom through Howard, and just collecting data, analyzing data, and because it informs what we do. What I realized as a Black person is that our ways of knowing and what I was taught in school are very different. And there is a way to merge these two things. It is a way to merge quantitative data, numbers, and give them a voice. And I find I was getting frustrated reading articles, public health articles, or listening to lectures where the numbers were given a voice that wasn't ours. And I'm like, hold up, who said that? Where did you get that from? Just craziness. I was, even during COVID, I was listening to, I saw some news clip where a white man said that, well, maybe, Black folks are getting COVID at higher rates because they don't have great hand sanitation.
Lies. Carry on.
Lies.
Don't even, not today, Erin, but
Okay,
keep going.
and the crazy thing about, like, every Black person I know would be like, boy, bye. Like, we are the most I can't eat at your house. No, I'm not coming to the potluck. I don't know what your kitchen looked like. Like, we taught you about sanitation. Have a seat. And so,
Thorough.
But when you just have a number, you are able to make it say whatever you want it to say. And when our systems are inherently racist, they are going to say all types of crazy crap. And so I think that it's important to give, especially these grassroots organizations, the tools and the knowledge to capture their own data. And also, when you get into the realm of data, it starts to get real big, real fast. So it's like you need like a $10,000 system, and you need all of these things, and you need to hire somebody who has all of these degrees to make it make sense and to be able to run it. And it's not true. You can run your own data on Google Sheets. I promise you can. But you have to know, okay, what are the steps that tell me what I need to capture and what does that look like? And that is an easy thing to give to somebody freely, but we don't want to, because that would not benefit our capitalist systems of okay, it's all about the money. And so that's what Hue Data Strategies is. It's really about giving grassroots organizations the tools that they need to be successful. It's about connecting them so that they can adequately data share. And it's about education. And here we are.
You're giving this unicorn army and everyone more access to the information and making those connections, because you're absolutely right that this is very much rooted in the capitalistic scheme of it all and white supremacy, gatekeeping this really important knowledge.
Yeah, absolutely. Yeah. Do you know how many times I've seen something that was created, an idea that came from a Black or a brown person, and when it fails, because the organizations fail not because they don't have the great idea, they have a bomb ass idea. Like, that's why it's there and the community is responding to it, but they aren't competitive for grants, or they don't know how to write a grant, or they don't know how to capture the data. They don't know what a theory of change is, or, all of these little jargony things that we put into place as the key to your success. And so when they don't meet those markers and everything falls apart, then the big organization that we've been seeing forever, with all the dollars and all the white leadership and all of the money and all of the access, comes in and says, oh, we have this great idea. And they repackage that thing and push it out like it was all them to begin with. And it's really sad and sickening. We talk a lot about at Mamatoto about the relationships between funders and organizations, and that there needs to be more than just a financial transaction. There needs to be some knowledge acquisition there, and some collaboration as far as their sustainability models and those kind of things, or else you're not actually being helpful. Like, the money will run out, but you're not willing to give that knowledge key that is going to be so important in moving this organization forward for the long term. And I think that is truly unfortunate, and it angers me.
And it's been happening for so long in a variety of areas. I mean, the ideas, the knowledge, the wisdom, the passion has been stolen and repackaged and made their own.
Absolutely. So let's even take it back to maternal and child health and think about like granny midwives who were demonized for, birthing these babies at home. And they were in there doing emergency cesareans. They had all of the sterilization techniques. They got rid of that, right? Said, no, you need to come into the hospitals to give birth, and said that your ancestral way of knowing, your ancestral knowledge is not appropriate. It's not real. You don't know what you're doing. And then all these years later, repackage it into like $2,000 white doula packages. Like, what? What?
Okay. Make it make sense.
A mess. A mess.
But nobody wants to talk about that, though.
But you're bringing that on today. So thank you.
Y'all gonna sit with it today.
What would you like to see for Mamatoto Village and the role of the perinatal community health worker? Like, what is your vision?
I would like to see Mamatoto Village really be a hub of knowledge, a wealth of knowledge for people that are looking to make true difference in Black maternal health spaces. Um, I want to see us expand our trainings, provider training, systems trainings, as well as those that are actually doing the community level work. And I want to see this model go national. We're in the middle of some big evaluations. We've partnered with Georgetown University to evaluate our program, so that once you get an evaluation, it kind of puts you in another tier as far as your expansion. And so I want it to be a nationally recognized model of care. I want it to be an option. So just like we have a checklist about what type of provider is appropriate for your care, like my general practitioner probably isn't appropriate for me if I have really severe cardiac issues. I probably need a cardiologist, somebody with a certain level of expertise. I want the same thing for perinatal support workers. Like, a doula is cool if you have support systems, if you have, resources and that kind of thing, if you have a certain level of education about perinatal health issues. But if you don't, if you are running more at risk, then I want you to be able to have a better option that will allow you to experience the same type of births that our mamas at Mamatoto Village are experiencing. And that can only come through the care of a perinatal community health worker.
I love it. I love it. I see the vision, the importance as a Black mother. Again, wishing I had made different choices, and was, I guess, offered the opportunities. I think that's having that up front. I have one more question before we go to some of our closing questions, but just you. So you're doing all of the things.
All
You
the
are
things.
literally all of the things. You are activist and advocate and professional superhero and momming, all of that. How do you balance all of those roles? I didn't even get into homeschooling as your protest. That's for the for another time, because that is my favorite, because that is a gift, and the Ward household, we don't have it, but I love it for you. And have been watching and just always in awe. You're my shero. How do you balance it all, especially now in the middle of a pandemic, in the middle of a reckoning and mess, especially when it comes to Black and brown bodies? How do you find balance and joy?
That is such a deep question, like a big question. As far as work is concerned, I think in work and like homeschool and just the day to day, I think the balance happens because it's all hard work. And I think that's what I learned leaving Howard, is that it makes sense and it doesn't. Yes, I quit, y'all. Once a quarter, I quit. I'm out of Mamatoto. Y'all not seeing me next week. I'm not coming. I quit. But then, because it's hard work, you pick all your papers up that you just threw all over the floor and you go back to work. So finding your heart work both in your home and outside of your home. So of course my babies are my entire being. So they always come first. I mean, if I am nothing, not Mamatoto, not nothing comes before those three. And so, finding something that you can be really passionate about and really driven. And even though you want to quit a gazillion times because it gets hard, because, and also doing this work as a Black woman. So you're living the same trauma that you are trying to intercede on is a lot. So finding your spiritual grounding is important for me. Like my prayer time is my prayer time. Journaling, resetting, taking a day off, not doing nothing without explanation, getting on my bike. I learned how to ride a bike again, y'all. I haven't ridden a bike since I was like 12, but it was just such joy.
I
So much
love that
joy.
because the last time Nicole and I were together, I was telling her I didn't know how to ride, and hopefully she will be teaching me one day. But we'll talk about that another day. But you better relearn.
Yes, you got to relearn. I mean, and I looked like a little baby deer, but it all came together. And, just finding that joy. And you have to be intentional about it. Community work, I always say, one of my lessons that I give my kids every day is take what you do and take what you know and give it back to your people. Whatever you learn is not for you, it's for your people. Whatever you decide to do, that restaurant that you want to open or that new invention that you want to make, you take that knowledge and or that gift and you give it to your people. And so that's what I'm really trying to live my life, is giving what I know and what I've been able to achieve back to those that have given me so much. And in that, I know I have to take care of myself too. And so that's what I do.
Wow. That's so powerful. And wow, you really are a unicorn. You are a unicorn.
Oh, thank you. It's crazy because I feel so unsure of myself. So I appreciate you all's affirmation.
One of the things that I love about how Bianca, reads your bio is because how many times do you get to hear your flowers and get flowers? And, we're really happy that we can be given all the flowers to this unicorn goddess.
I appreciate it. I do.
So I'm going to ask you some questions now that we ask all of our podcast guests. And that is, what do you love about the South? And what do you want to see for the South?
What do I love about the South? I love that it is. So, I'm a Maryland girl, and I always say that we are the northernmost southern state. And so we're a little bit country, a little bit rock and roll, like somewhere in between.
Perfect way to define it.
It is. It's this. And so I love, but I still live in Southern Maryland. So I think I have a little bit more Southern than I do Northern. But I love that it's slow. I love that my kids still go outside barefoot and run in the grass. I love that the grocer knows our names. I love that small town feel. And I hope that the South can keep that part of Southern culture as we grow past all of the, racial BS that we have lived for so long. It's been too long.
Thank you. Sometimes I wish there were words that were bigger. But thank you. It is amazing to be in this particular space with you because, again, we've known each other for a long time, but I never get tired of hearing your passion, your drive, your wisdom, your desire and willingness to serve. So I thank you for your service. I thank you for giving the community what it needs, and also your children, and finding time to take care of yourself in order to continue to give to the community. So thank you. If folks want to learn about Mamatoto Village or Hued Data Strategies, where should they go? What should they do?
They can find both of those on Instagram and yes, Instagram and Mamatoto Village. The website is www.mamatotovillage.org for more information there.
Thank you so much, Erin. It's been such a pleasure to not only get to meet you, but also to bear witness to this beautiful friendship. You can really see the joy and love for each other that y'all have, and it's really nice to see. And I'm really happy I could have been here for today's conversation.
It's just Just a BFF love fest over
It
here.
is. I love you so much. Thank you all so much for having me. This has been amazing. And thank you for creating a space that just is so easy. Like I said, I can tend to be a little unsure of myself when speaking, but you guys are great.
You rock. You really do.
You did an awesome job. We thank you. Thank you for joining us. Thank you for sharing your wisdom. And we hope to see you again soon and hear more of your amazing journey. Thanks, Erin.
Thank you.
Thanks, Erin. That was a powerful conversation with Erin. And it was just I feel like that was a gift. I feel like we just got a gift on the Southern Steep.
I hope the listeners learned and received just as much as we did, because it really was just phenomenal. It's time for a segment we call Southern Charm. Here we highlight the work of someone or an organization that is charmingly impacting the South. This week, we're highlighting Black Swan Academy. Black Swan Academy is a nonprofit organization in the District of Columbia that concentrates its effort on empowering the Black youth through civic leadership and engagement. The Black Swan Academy empowers Black youth in underserved communities through civic leadership and engagement, giving them the comprehensive set of tools needed to succeed in life and become active social catalysts in their communities. They are committed to creating a pipeline of Black youth leaders that are committed to improving self, as well as their communities through a variety of activities. And so I found out about Black Swan Academy from one of our colleagues, Mahalet. And as soon as I learned about them and the role of empowering Black youth and what that looks like in terms of giving them the tools, the resources to understand their community around them, how they can impact it, how they can become future leaders, starting in middle school, just felt right for this as we have these conversations about, one, about DC and Ward 7 and 8 specifically, but also the role of Black community, family, children. And so some of the things that they do, they have a civic leadership and engagement after school program. They have an annual civic leadership summit, which is the opportunity for them to learn about advocacy in their communities, and just engage with leaders and just empower themselves to be the change that they want to see in the world, which, yeah, even as I said it, I feel like that quote feels right.
You know, when I was reading a little bit about Black Swan Academy, I agree that it was a really appropriate, air quotes, appropriate choice, because when talking about maternal and child health, adolescents are still considered part of the MCH universe. That could be like a whole other thing, like MCH universe, MCU universe. Sorry, that's an aside. But really transformational leadership.
Mm-hmm.
They are building the leaders of tomorrow. I know that sounds like a really corny quote, but it's true. Like, they're making the investment now. And I think that's the work they're doing is incredible.
One of the things I was drawn to on the website, and hopefully I'm already putting it out there, that we will have their executive director on in the future so that we can learn even more about the work that they are doing. But their Black Youth Agenda, which was created by middle school and high school youth, just one, is powerful. So the website is blackswanacademy.org, but the Black Youth Agenda speaks to very specific concerns that they have in their community, like safe and affirming spaces for Black queer youth, addressing violence by investing in communities and moving beyond policing, and then the need for support and resources for youth that are unstably housed or facing housing instability, and especially in the district, that is a huge issue. So just moving past surviving to thriving. And I think this organization is really setting up the youth to lead that charge.
And, the youth know what they need.
Mm-hmm.
The youth know what they need. And I think that giving them leadership positions and really helping them use their voice is going to help make a huge impact for all youth.
And I think Erin touched on that as well when she mentioned that community knows what they need, right? So the mothers that she spoke about, the families, the youth, they know what they need to thrive, the areas that need improvement, what the resources that need to come into the community in order for it to be safe and sustainable. So yeah, just starting young and keeping it going. So our Southern Charm, again, is Black Swan Academy, blackswanacademy.org, to learn more about them, the amazing work they do. And yeah, hopefully we can chat more with them in the future.
You manifest it and let's make it happen.
There you go. Come on, manifest. Thanks, everyone. I'm Bianca Ward.
I'm Nicole Elenoff.
Thanks for listening.